Hi, I'm Dr. Sunanda Kane, and I'm a gastroenterologist at the Mayo Clinic in Rochester, Minnesota. And I thought I would take a few minutes just to alert you of a new scientific paper that is out in the literature about inflammatory bowel disease and the association with adverse birth outcomes, and thought that it's probably worth just clarifying what that means. So in this study, obstetricians in the Kaiser healthcare system in California were able to study a very large number of their patient population and compare the outcomes in pregnancy of women who had ulcerative colitis or Crohn's disease compared with mothers that didn't. And they were able to look at this over a 12-year time frame. Now, they were not able to take into account certain kinds of medicines like Remicade or Humira, but were able to look at other common types of therapies that we use for inflammatory bowel disease, and importantly steroids. So what did they find? They found that women who had inflammatory bowel disease were more likely to give birth to a child that was small for gestational age or was preterm. They did not find that there was any increased risk for these children having birth defects or increased risk for infections or any kind of childhood cancers up to the point where they finished the study. So interestingly, they also were able to show that the risk for these outcomes were more likely to happen in ulcerative colitis patients and not in Crohn's patients. And that up until now we used to think that perhaps Crohn's disease was more of a serious disease, and that women who had Crohn's were more likely to have complications during pregnancy, but we're not so sure that's the truth anymore. So the bottom line here is that none of these outcomes are new data. It's just that they're being published now in the obstetric literature rather than in the gastroenterology literature, and that these are the same outcomes that we've been talking about for years now, that women who have inflammatory bowel disease are more likely to have a child that is small for gestational age or preterm. The obstetricians were able to also look at those women who may have issues with placental ischemia, meaning that they were having problems expelling their placenta, something that gastroenterologists don't have any knowledge of. So that was something else that was found, but otherwise the quote-unquote adverse birth outcomes are exactly the same as we have been reporting in the gastroenterology literature, and are not associated with an increased risk for birth defects or for spontaneous abortion or for stillbirth.